Welcome to CareHero Podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Hey, Care Heroes! Thanks for joining us for another episode of Care Hero Podcast. I'm your host, Gerard Hernandez.
And I'm Martin Hoy, and we've got a wonderful guest to introduce for today's Care Hero Podcast episode.
Yes, today we have Marlene Feagan, a Health Ministries Faith Community Nursing Coordinator, joining us from St. Elizabeth Healthcare in Northern Kentucky.
That's right, Gerard. She's a registered nurse with 34 years of experience in clinical, managerial work, and project management, who's passionate about being a faith community nurse and continually works to break through barriers to advance the practice.
And Marlene has such an inspiring story and valuable knowledge to share, including the importance of finding your passion and believing in your daily mission, to always show humanity and treat people with kindness and compassion, the value of learning and growing from your experiences, the significance of a strong support system, and also to remember to enjoy the journey.
Incredible, Gerard. Let's do this.
Marlene, we always start off the show with this question. All of our care heroes, including yourself, are superheroes. But if you had to choose one superpower, what would that be and why?
My superpower would be teleportation. I would like to be able to go anywhere. Suddenly, you just think about it and you wind up, because then there's no traffic. I'm never late. I don't have to look for parking spaces. Love the idea of it.
It's more efficient and probably helps get you to spread all the great things that you do around to more people.
Well, and it would just give me more time back in my life, which is one of the things we're all trying to do.
Absolutely.
That's great. And then Gerard mentioned, you manage field sites with over 400 employees in 80 faith communities. And so that would help you get to each of those field sites in an instant.
It would. And I would probably show up in a more positive state based on the fact that I didn't deal with traffic or a closed bridge or some of those things that do come up.
We'll be talking a little bit more about that later in the episode. But for now, Marlene, we want to get a little bit more about your story and your background, because you're a very experienced and passionate healthcare professional with over 34 years of experience as a clinician, manager, and project manager. Could you tell us a little about your life story, your background, and how you got into healthcare?
Originally, I was working with a background in psychology, working with teens in an eating disorder program, and loved what I was doing, loved the being able to talk and communicate and teach and support. And the piece that I was missing was the physical part of it. So I was really drawn to nursing for that. I was interested in the science and the art of nursing, to be honest. I love the idea that you can merge science and art at this junction where you're then very present and available to people. So I went into nursing and did a 2-year degree, completed that at Purdue. And my first nursing job was as a pediatric bone marrow transplant nurse at Children's Hospital in Cincinnati. And in that 2 years, I learned more about nursing than I ever imagined possible. The technical part was there. The raw emotions of dealing with such sick children. And I realized the thing that I really loved about that job was the family systems that you were in. So you have an identified patient, but you have this family system that you were also serving. And some of that, sometimes that was very extensive, or it was someone from another country. And so you became very close to them. So I learned a lot in that original job, and probably a lot of my clinical skills got honed there. But what I was really wanting was to do more of that kind of individual work. And I was drawn back into working with adolescents in a chemical dependency program. I loved particularly the weekends where you could wear a t-shirt and jeans and sit on the floor and talk to a kid for hours. Because in doing that, you learn so much about yourself through their lens. And I think that's the thing about nursing that is the most exciting part for me, is being that listening person to another individual, becoming a trusting entity to them. I mean, building that trust is everything. And so I did chemical dependency for, I think, 16 years or so, until there was no longer that long-term treatment. That was another situation where we had patients for 6 weeks. You got to know the families. They were coming in and out of groups, and did a lot of building during that period of time. So at the end of that, I was kind of looking for what I wanted to do. I had completed my bachelor's of science in nursing at Mount St. Joe, and had worked with some really good nurses around theory of nursing, and everything just kept calling me back to this family systems work and the whole person approach. So definitely started with that in bone marrow transplant, but it was core. I was exploring, and I had an opportunity being in Chicago to meet Granger Westberg, got involved with going to a site of his, and actually came back and wrote the program for my work. So I think that's one of the things I always want to encourage nurses. You have an idea, take it forward. Administration is there to serve just as you serve patients. So I took it to my CEO. He took it to our board. And so for over 22 years now, we've had a health ministries program, which has become part of the culture of St. Elizabeth Healthcare.
It's such a wonderful story of how you started with teens and working in psychology and went into nursing and loved it so much that, you went back in because you have such a deep empathy and connection to and drawn to working with these children and adolescents. That's, I think a lot of us know folks who have chemical dependencies, and you need to have a lot of patience and a lot of love to do what you do. And so it warms my heart.
When I was doing chemical dependency, I would have people say to me, "Oh, it must be so depressing," or "It must be hard," or "It must be just so challenging." And what I found it to be was incredibly rewarding. I worked with great people. I mean, I think that's one thing in healthcare. When you have a team of committed people, there is nothing that is as supportive and as tight, and, you can depend on people. But I never looked at chemical dependency as, oh, you might be disappointed in a patient or an outcome. It's not about you. And so what you realize through your faith is that you are kind of this conduit, and you're there for the person, but it is for them to be able to try to find the tools. And so I think that's maybe one of the bigger aspects that I've ever learned in life through my nursing. I'm not disappointed when a person that I'm working with now, because I currently work with a lot of vulnerable, underserved people. They can't stay on their meds. My role is to teach them, to be there, to try to support them, and to figure out the barriers. So it's been great for me to be able to grow personally and professionally through my role as a nurse.
That's wonderful. So let's talk about this program that you wrote. That's what you're doing now. So let's talk about, you're currently the Health Ministries Faith Community Nursing Coordinator for St. Elizabeth Healthcare in Northern Kentucky. So can you tell us more exactly about what your role is and what you do?
Sure. Faith Community Nursing is a nursing specialty under the American Nurses Association. And so for all nurses, we are to assess and incorporate spiritual care in the care we provide for patients. And what Faith Community Nursing says is that it is an elevation of that to where intentional care of the spirit is part of every nursing interaction. So originally, we started with just 2 churches in Northern Kentucky to open programs where, through volunteer healthcare professionals in those churches, we provided educational programs, monthly blood pressure screenings, blood drives. We would bring in the mammogram van or the vascular van, but just brought health and the church back together, which was really fundamental for the church to begin with, where people could see the church is a healing health place. So we built programs throughout Northern Kentucky and have worked with churches on an array of topics. And each of those church programs are unique to that culture because no two churches are alike. So my role is to help them to develop health and wellness programs within that faith community. And then about 12 years ago, I had this idea that what would it look like if we were out in the community where people were, vulnerable people. So someone is getting commodities, they're coming in for food, they're coming in for a meal. What would it look like if faith community nurses were there? So we have 7 sites where we are routinely. And what we do at those sites is health screenings. We provide a connection for a medical home. So we will make sure that all of our patients have a physician, because many of the population that are homeless and that we see prior to the Affordable Care Act had never had a doctor. They used their emergency room. So if we connect someone with a physician, we will provide bus passes for them to get there, or Uber Health, or whatever it takes for them to get to their appointment so that they can establish a relationship ongoing with a physician. So trying to figure out what the barriers are for the people we serve and make sure that we try to move past them as we build a trusting relationship. And sometimes that trusting relationship is so necessary because if you've been in prison, trust is just not there. It takes us a while to see them several times, and we give out a lot of help. So we provide toilet paper, socks, any kind of hygiene items that they need. And right now it's been cold, so we have blankets and coats and those kind of things. Even though it sounds like what we do is all good, patients that we serve don't realize it. So we have to kind of draw them in and build that relationship. It actually does work.
You're making yourself indispensable.
Well, many of our patients, like George from 10 years back, who was living under one of our bridges when we met him, is maybe my most compliant hypertensive patient I've ever worked with. He tries so hard.
With churches being such a central part of many communities, especially rural communities, this is a great way to serve all those underserved patients.
In the churches, what we do is we work with nurses who are part of that faith community, and they're providing the care, and they know the people. And healthcare illiteracy, which we think about as just that vulnerable population, it's not true. People need so much help, like they'll get a diagnosis and they need to work through. What does that mean? The medication, I'm taking it, I'm forgetting it, whatever. The nurses that are there routinely build those relationships too. So it's right there in the church.
And Marlene, you also hold the credential of Faith Community Nursing, RN, by the American Nurses Credentialing Center. Could you tell us what that involved and how it's helped you in your work?
So obviously in nursing today, education and paying close attention to kind of what's happening, we're all looking to do that. And certification is just another one of the steps on your nursing journey that help you to gain more insight into your specialization. So certification was by portfolio. And certification is you make the commitment that you want to do this additional work, and it helps you to reflect on what you need and what you need to build on. And so I think it's really important for nursing because it pulls you in. Every nurse has the availability to become part of ANA. You belong to ANA because the information comes across my desk every day and I read that. And then you have your state nursing organization. It makes you feel very, very proud, I think. I felt very, very proud when I became a certified nurse. And I think it's a very exciting option that is out there for nurses. It helps you to look at who you are and what you need to grow.
How long does that take to get that certification?
It's a process. It takes a while, and there are a couple of ways to get your certification. But first of all, you have to be in the practice for a while to build up so that you have your background for the certification. But the process, it's probably like a year-long investment the first time, and then you get recertified every 5 years.
Marlene, what is the biggest challenge you have with your current role, and how do you overcome that?
So this last year has been an interesting challenge. With our faith communities closing, which they were closed early on in Kentucky, our governor, that was one of the things that he did. And a lot of those churches are still closed, are working at 25% capacity. So what we have done is try to provide ongoing information to those churches. The Health Ministries program has branched out. And things that I have had an opportunity to do in the last year have really pushed my practice because I've become involved. So early on, if we go back to April, when our numbers were starting to really climb, our COVID numbers, we recognized that we had a very high Latinx population in our hospital. And one of the roles I have played over the last year is working with a group of physicians. There's a lot of diverse people in this work group. We went and looked at what these numbers meant. In Kentucky, we're not the most diverse community where I live. And what were we going to do to address the needs of this population? So we did multiple levels of things, and I was involved in trying to get information out into the community. And I knocked on doors and I contacted churches, and we found that we were going to focus on where people work and where they worship and where they wash their clothes. So we took information out to all of those entities. We have doctors who went into the workplace and talked to some of the factory workers that we have. And I hung clings on doors, and we changed out information about every 3 or 4 weeks on COVID. And we also used some barbershops along the way too, when they started to reopen. But we really focused on this group of people, and we made an incredible change in a period of less than 6 weeks on our numbers. And we're continuing to work with these more vulnerable populations right now on COVID vaccines. There have been a lot of changes in the last year. There have been major challenges for all of us, and it has caused my program to have to work a little differently. But I will tell you, through all of it, looking back, as bad as the year has been, we have made some major strides in my community about better understanding who we are and how we serve. And I'm really proud at St. Elizabeth that one work group is now grown into 3 work groups, and I'm serving on all of them. As we continue to look forward, how can we better serve everyone in our community?
3 W's: work, worship, and wash. Truly community-based healthcare.
It is. I was skeptical of my idea about the laundromats until the first one that I went into put up a cling, and I left 25 brochures. And within a week, I got a call back because we were leaving information in English and Spanish. And the woman that I met who worked there said, "We need more." It's just been exciting to see that there are avenues to work around these barriers in the community. And it's just kind of by trial and error.
This also sounds like you've been building resiliency in your practices, and you gave a presentation in 2018 titled Resilience, Building Practices for Flexibility in Stressful Times. Could you tell us a little about that presentation and how those principles have applied during the COVID pandemic?
For my hospital system, my building where my office is was our COVID building. And so I have lived with seeing the most amazing response by everyone in our building. It is not just nurses and physicians. It is environmental services, and it is the people who are cooking in our pastoral care department. And I feel as though, as hard as it's been, there has been a real understanding of individuals, who they are and what they are capable of and what they had to bring. I mean, when you have a patient who is as sick as these people have been, and you have to be everything to them because families can't come in, it is a real struggle. And that's where I have seen people who have had the strength of their faith and their life experiences brought to the forefront. And they have been able to be the most amazing presence to people for 12 hours and then go home to their families, where there is also COVID stress. And then they get up and they come back and they do it again the next day. People have had to dig very deep, and there have been conversations and tears and working through all of that. But I think for healthcare, and what I have witnessed in my building, is that we are going to be stronger coming out of this on the other end.
Sure sounds like the team's come together, as we've seen it all across the country, which is really heartening to see.
Marlene, you do such fantastic work everywhere. And of course, it's finding the good even through the challenges. So what do you love most about all the work that you do?
The people that I have an opportunity to serve and to serve with. Being able to work with people and just to be with them, to be present to them, is just an honor. And that's one of the things I've always felt about nursing. It's a very honorable place to be when you are that intimately involved with another human being. But then on top of that, I have been so fortunate to have people in my life who have supported me. And when I came up with this idea years ago, and I thought it was a great idea, I was a novice, and I was able to go to my first conference. And at that conference, I met a woman, and she has been a mentor to me. Sharon Stanton is an amazing human being, and she's like a lot of nurses I know. She's so smart. She has made herself available to me, whether it's been on a clinical level or I just need a question answered. She's someone who I can sit and talk theologically to. She has been there for me and so many other nurses along the way. She's a real leader in my specialty, but there have been so many of those nurses. And I really encourage young nurses to find your person so that when you need that support or you need just someone to bounce an idea off of, that you have them. I could never have gotten to where I am in my nursing career without those people investing their time in me.
The passion that you have to serve others just exudes you. I think it's so easy for people to want to support you. And I think it's a good lesson too that you're promoting to your potential young nurses, that to find that person. Because if you're passionate about this, it's really easy to find those individuals that are going to be able to support you along the way.
And Marlene, now that you're likely one of those people that younger nurses look to as being a role model, like how would you want to be approached by a less seasoned nurse to seek that mentorship? Like, what could someone do to best position themselves to get a yes from you or others like you?
I think first is you just have to reach out, just start to talk. Nurses are incredibly engaging individuals, and they love to share and they love to support. Nursing is hard. It is hard. I don't think people realize, I think in the last year, we might be looking at nurses a little differently, because I am telling you, 12 hours of focused commitment, it's hard. And so having someone that when you have a doubt, anything that you have a question about, maybe you have the idea that you want to take to someone in administration, or you want to take it forward. Having someone who's been around a little while, who might know those steps, is going to be very useful. And I think that's why I really encourage people in a healthcare system, because our system is large, is to get involved by saying, now that I'm here, now that I'm working, what can I do to help? Is there a way that I can help reach out in the community? People call me all the time about volunteering opportunities, and we get them connected. The more you are reaching out, you can work through some of those issues that might come up. You grow. I think there's a lot of opportunity for all of us to better connect.
Talking about growth as a nurse leader, you have to stay up to date with everything that is going on in your field. How do you stay on top of things within your role?
A lot of prayer and making sure that you are kind of looking at the whole global picture. I have personally had an opportunity that St. Elizabeth has given me to be connected with nurses from across the nation. And that has been very helpful to me. And that's where A&A comes in, because you might be able to work on your scope and standards. You can't be a nurse in a silo, because if you do, you're not going to be very happy. And I think that when you start to reach out and look for that mentor and look for those people and figure out ways to better understand how you can work more effectively, that you just become happier in your role.
You really can't operate in a silo. You need to get out and be in the community. I think that's one of the things that I'm getting most from your practice, and how that's shaped who you are and what you do is you're constantly checking to make sure that you understand the community you serve. And I think that goes for everybody, whether you work in a hospital or a nursing facility or in the community.
Absolutely, because the more you know about the global environment that you're working in, the better you're going to be working one-on-one with that person who just is struggling on the street, going to the methadone clinic. You can develop more of a heart for the understanding, and therefore then you're not going to get irritated. You're going to be more open in the moment. And I think a lot of that has to do with faith. In nursing, it is such a sacred practice. When you get frustrated or upset or short about someone, you have to bring yourself back to the fact that I believe nursing is an art and science. I think it's at the junction of faith and health too. And that faith helps you to see the sacredness of what you do every day. I frequently have to center myself and just realize that I don't have the answers, and I'm comfortable with that, always honest about that, but that maybe in being a caring presence to a person, they will feel that. They will know that they are part of this universe, that it's really beautiful, that they are more than what they have put on themselves. And that's one of the things that we do in the community, because being there for people in that kind of intimate space does make a difference. It is life-changing. And I know it because I feel it in others. And that's what we try to give to the people that we serve. And I think all nurses do. That's the spiritual side of that whole person care, which is what we are about. It's the physical, the emotional, and the spiritual care that we are delivering.
How does your faith drive you and your colleagues' purpose in what you do and how you serve your communities?
Personally, my faith is core to who I am. It was a gift that I was given as a child, and I did not realize how core it would be to my nursing practice, but it has been. And it has to be, because the work would be impossible if you did not understand that faith and health intersect. It has nothing to do with religion. It has everything to do with your spiritual connection, whatever that is, and bringing that forward. Some people exude it in a different way. We have a physician who is a cardiac surgeon who prays with his whole support staff before they go into surgery. And something like that is beautiful. But for some of us, it is more private. Your faith, how it comes into your practice, it works for you and for the other when you allow that to grow.
So, Marlene, given your unique experience, if you could change anything to improve healthcare in America, what would you do?
That's an easy one. So right now, it's a very exciting time to be a nurse. Opportunities are boundless. Nobody can precisely guarantee how the future of nursing will look, but I think nurse aspirants should be on the lookout for career opportunities to improve the healthcare system. I feel as though we have this increased technology. It's allowed staff and all of healthcare to better communicate. But I think there is a rising trend in technology that is being used to give patients better access to their care and communication with their healthcare team. But there has to be growth, and there is going to be growth moving forward in telehealth and nursing chatbots services that will assist individuals with things that are going to be good for them, like reminding them to take their medication. My hope for the future is that there's an intersection where nursing and technology is focused on how it affects interactions with patients and nursing job satisfaction. As technology keeps moving forward and you keep getting these updates, in the day, it was the personal care where you could help somebody get ready to maybe sleep, help their medication to help at night. I believe moving forward, we have to have a better understanding of the art and science of nursing again, and where we invite the art back into our nursing careers. We need to remind ourselves of why we went into nursing and focus on that joy again. And I think we will get there. Trust me. I think technology will improve and give us some time back. I think we're in a period of time right now where we kind of view technology as taking our time. And I guess it's getting to the point where it starts to give us some of our time back. I believe that healthcare professionals and smart young people and people into IT are going to figure that out. They will help us to cope with the science and enjoy our calling again when we figure out how to better use the technology that's being put before us.
Certainly, so learning the technology, using it, but also how you could intersect again that love for nursing and, like I said, bring the art back into this passionate career.
I believe it's essential. I believe it will happen. I believe there are going to be some smart healthcare entrepreneurs come along and some nurses. We have so many smart nurses working in IT now that we will figure it out. But for right now, I think we're not there. And that is what we need to look at for the future of nursing.
Marlene, it's been such a great time speaking with you. Do you have any final thoughts or advice to share to our care heroes?
I get very excited when I see nurses and younger nurses who have come into the field, because I will be the first to admit that nursing has been very good to me. I don't know of a career that I could have ever chosen that would have given me such insight into me, allowing me to grow personally and professionally. So I really do encourage people to just be open to the possibilities. Enjoy the journey. Nursing school is not easy, but I really encourage people to enjoy that journey all along the way and to really try to stay in the moment. Don't get too far ahead. Don't be that worried about making the correct right choice. You might be in one area of nursing and it's just not for you. There are so many possibilities of places to work and ways to work and specialties to work in. And I think that there are so many opportunities for continuing education and ways to get involved and grow and write. And that's the main thing too. Tell your story because it's amazing. You're amazing for what you do. Your story is amazing. I want to hear it. And I know other people will too. So I think that that is one thing that we all in this profession can do a little bit more of.
That was such an uplifting episode, Marlene. It's really inspiring and interesting to hear about healthcare from a faith-based professional's perspective.
Yes, Martin, and you can tell she's genuinely found her calling and she's really devoted to what she does. Now you know what time it is. It's time for the handover.
Okay, Care Heroes, here are your top takeaways from this episode. Listen to your heart and find your passion. When you truly believe in your daily mission, you will love the work that you do. Always show kindness and compassion. Remember that each person has their own unique story and is deserving of respect and decency. Don't be so hard on yourself if things don't work out the way that you hoped. Do your best and remember that each experience is a chance to grow and move forward. Surround yourself with good people who help uplift you and support you physically, mentally, and emotionally. A strong support system can make all of the difference. And last but not least, don't worry too much. Live in the moment and enjoy the journey of life.
Awesome handover. We also want to thank our Care Heroes for listening, and don't forget to rate our podcast on your favorite podcast app. If you want to shout out in a future episode, just visit careheropodcast.com, go to the Contact Us page, and submit your name, role, and location for a shout out in a future episode.
That's right. Now it's time for some shout outs. We want to give a shout out to Kristen, hospice nurse from Las Vegas, Nevada, Missandra, nurse manager from San Antonio, Texas, and Michelle, ICU registered nurse from Toronto, Ontario, Canada.
And a shout out to you, our Care Hero community. We appreciate all the love and support. Thanks so much for tuning in. We'll be back again soon. Same Care Hero time, same Care Hero channel.
Thanks for listening to Care Hero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.